We are joined today with Dr. Khalifa El Musharaf. He is the Director of Public Health Programs and Associate Professor in Public Health at University of Birmingham. Dr. Khalifa, thank you very much for joining us today.
Thank you.
Can you discuss how the diverse qualifications and experiences have shaped your approach to public health, education, and research at the University of Birmingham?
This is a good question. Usually I say I have two hats, a hat of clinician and a hat of public health.
Yeah.
So I'm a medically qualified, graduated as a medical doctor, worked as obstetrician and gynecologist, delivering babies, worked in maternal ward for a few years, and then I moved into public health. So I did my medicine degree in Sudan, and then I moved to Ireland in 2008 to start my PhD. That was funded by the Irish Aid. And I started looking at health system research, but focusing on access to maternal health care in conflict and post-conflict settings. After that, I moved across different universities, Irish universities. So I worked with the Royal College of Surgeons in Ireland, and then moved to Bahrain to start a new public health department in the School of Medicine, and then moved back to Ireland to University of Limerick, where I started a new master program of public health for like 7-8 years before joining the University of Birmingham here in Dubai to start our new master program here, which based on 25 years of experience in doing the same thing in Birmingham. So I'm bringing that kind of clinical and public health, working in academia and research, and working as an advisor to WHO and UNDP in different.
And how do you see, what are the most significant challenges and opportunities you see in addressing the maternal health and the economics of non-communicable diseases?
Brilliant.
Especially in the UAE as well as globally.
Okay, so two things here.
Yeah.
So for maternal health and non-communicable disease, for maternal health now, we are moving into the pre-conception health.
Yeah.
We need to act early. It's too late to start during pregnancy. We need to have a better preconception care and health. So this is one of the projects and research that we're currently doing. I have few PhD students working in that area. The second challenge is the non-communicable diseases. We did a study in year 2019. We found that the four main non-communicable diseases in the 6 GCC cost the GCC more than $50 billion in year 2019. So these four diseases, non-communicable diseases, drive the economic burden. So what we're trying to do is we're trying to build investment cases. Why should we invest in prevention and control of non-communicable diseases? Obesity, hypertension, and other cardiovascular diseases, it's really driving the disease burden. So these are the two areas that we're currently focusing on.
So how does your role, you're also writing for a lot of academic journals and a lot of publications. So how does your role as an associate editor for various academic journals influence your work, as well as perspective on current public health issues?
This is a really important area because, publications, it's a way to share lessons that learned, and it's important for different journals to set up the themes, the direction that they want to go, but also to make sure that we have the rigorous research that really address the needs of the population. So I work as associate editor for the BMC Health Service Research, and I work with International Health Oxford Journal and other journals. So we are trying as a board of editor to kind of look at what are the themes that we need to focus on. How can we make sure that the research that we're publishing are rigorous and following, standards?
I think that's really interesting, and it complements the role, especially as an academia, what you're doing. What are the key strategies and interventions that can be implemented to reduce the high rates of maternal mortality and ensure that the safe pregnancies and childbirths globally?
So as I said, working at preconception care is really important. Reducing the early child marriage, like we just published paper in Nigeria talking about that. Reducing female genital mutilation, have adolescent healthy with no smoking, physically active. So working at that stage is really important because it's early stage of intervention. And then access to care from both sides, the supply side, but also the demand side. Working with communities, encourage the intergenerational dialogue, between, newly pregnant women, their mothers and their grandmothers. So building those links at the society level, engaging the society and empowering community to take decisions. This is the most important. But we just had a webinar about investing in women and how that will really have a huge impact on economy. So working on maternal health is not only a health
when you're
issue.
talking about investing in women, are you talking about investing in women healthcare? Or it was
health is
okay.
Health is one issue.
Issue part of
But
it. Okay.
education, leadership representation, women empowerment, this will all make a healthy woman
Yes.
that will have more participation into the economy, not only for her, but also for her family and for her society as well.
How do inconsistencies in the definitions and classifications of non-communicable diseases impact our ability to accurately measure and respond to maternal health challenges worldwide?
Okay, there are two things here. We're talking about communicable diseases and maternal health.
Yes.
To be honest with you, we know enough about how to prevent non-communicable diseases.
Yeah.
We know that the main risk factors, smoking, alcohol, physical activities, salt. We know these things. We know the impact. We know that if we invest in prevention,
Yeah.
that the health benefit will be huge. We just need from countries political commitment and change the narrative from spending on health to investing on health. Because if we invest in prevention, we found in the paper that we recently published that in GCC, for each $1 that we spend in prevention and control for communicable diseases, there is a return on that investment of $5. So this is, we are not spending, as I said, we are investing. So I think this is the most important, is to take the decision to...
So instead of focusing on prevention, rather preventive measures.
Exactly, rather than... Exactly.
Yes.
Because now we are just treating diseases that already happened at hospital level.
Yeah.
And we spend a lot of money. And the solution is easy. We can just prevent or spend less.
Absolutely. Yes.
Yeah.
So how do you see the healthcare providers be better equipped or trained by, as you have rightly saying, by investing in NCDs?
Yeah.
So how can we ensure that they are more equipped or better trained?
This is a very good, important issue because education changed now.
Yeah.
We are moving from traditional medicine teaching and traditional way of teaching into more kind of problem-based case study, more critical thinking. We are now focusing on competency-based education in which we equip our healthcare providers by transferable skill sets that will help them to kind of work and, and have better patient outcome. So I think we need to shift our education from the traditional education to competency-based education in which we are, I don't care what my student know.
Yeah.
If I want to hire him, I want him to know what to do. If I have
Absolutely.
exactly
What can be implemented?
what can be implemented. What if I hire you? What can you do for me?
Absolutely.
I don't care about what you know. Now you can go to ChatGPT. You can watch on YouTube. You can tell me everything. Can you do this thing? So
Yes.
it's important to shift to competencies and skills. And this is what we do here in University of Birmingham.
Yeah.
We shifted the education. We minimize the number of lectures. We don't do lectures anymore.
That's
It's
I
flipped
think.
classroom.
Yes.
They can study and then they come to us and we do kind of workshops, hands-on experience to kind of galvanize those kind of skills.
Okay. So in what ways, what are the global initiatives and policies which can be used to restructure or prioritize the fostering a more holistic approach to women's health?
This is a big question.
Yes, it is indeed a
This is a big question.
Yeah.
But, as I said, we were talking about equity.
Yes.
Talking about it's beyond equity. A recent report by the World Forum for Economics said that women spend 25% more time in poor girls. This is not only a health issue. It's an economic issue.
It's an economy issue. It's a family issue.
Exactly.
Yeah.
And a different cycle. So it's important to see not only the social issue, but also the economic part. Because if we understand that, we can convince Parliament to allocate more funding
Yeah.
into this area, because the impact is not only on the women's health, but the health of the children, their educational attainment. And if we have an empowered society that have empowered women, you will have a better health.
Better, absolutely.
Right. So this is where should we focus. They will be able to take the decision when they want to take the decision.
Thank you very much for
Thank you.
talking to MediWorld Middle East.
Okay, thank you very much. I appreciate that.